Now, Upper West Deputy Director of the Ghana Health Service in charge of clinical care, Theophilus Osuansa, has attributed the increase in mental health cases in the region to the use of drugs and high alcohol intake. Mental health cases in the region for the past couple of years have doubled. He said for the number of cases to reduce in the region, they need to do a lot of advocacy to change the trend. Osuansa made the statement at a press briefing organized by his outfit to observe World Mental Health Day in Wa.
World Mental Health Day is observed on 10th October every year with the overall objective of raising awareness of mental health issues and mobilizing efforts in support of better mental health. This year's event is held on the theme Mental Health in the Workplace. It is in line with the aforementioned that the Upper West Health Directorate of the Ghana Health Service organized a forum for media personnel in the region to brief them on the state of mental health cases in the region. Cases of mental health in the region for the past couple of years have been on the rise. Depression, epilepsy, bipolar, organic, mental, schizophrenia and delusional disorders had their figures doubled. Upper West Deputy Director of Ghana Health Service in charge of clinical service, Theophilus Osuansa, blamed the increasing cases on the use of drugs and high alcohol intake.
The use of marijuana, name them, and the latest craze in town, tramadol, which people refer to as Tramol. People are now even going in for Benylin cough mixture, the one that contains the codeine. They are using it, you know, in the same way they are using the Tramol and all this. And people are taking in Valium of high, grams, high doses. And so all these things lead to these mental health problems. For starters, they will see that it's sort of giving them euphoria. But with time, they get hooked onto it, and then they become addicted. Don't let us run away from alcohol as well. It is also becoming another craze in the system. Almost every alcohol we are now hearing about is an aphrodisiac, it's got betas, it helps men in their sexual behavior. And so people are again going in that direction. That is what people are taking. At the end of the day, they all lead to people becoming alcoholics, and then again it becomes an issue for us.
Mr. Osuansa noted that one of the key challenges that they usually face is the acute shortage of medicines for the patients.
We are blessed in Upper West because Basic Needs and other organizations do help us with medicines. And so for now, yes, we have it. This year, the idea was to procure using the procurement system so that we'll stock them at the regional medical store and serve it out to our clients through the health insurance. Unfortunately, as we speak, the one who won the bid has still not supplied. He's telling us we've contacted him, and he's telling us they are having challenges with the medicine as if it's locked up in Kenya. And so we are looking at it. The other thing too, the regional pharmacist for now is doing is to try to find out if there are pharmacy shops that can supply us that quantity, help us with some quantity. Then we use them in the interim whilst we await the people who did bid. But as we speak today, yes, we can get medicines for the client.
Speaking on the theme of the day, mental health in the workplace, a medical doctor at the Kolubu Teaching Hospital, Dr. Sheila Apia Pempem, called on Ghanaians, especially workers, not to forgo their annual leave. Reporting for Joy News, Rafiq Salam.
Liberians have voted hugely in the first election run entirely by the country's institutions since the end of civil war in 2003. The two elections in which Africa's first elected female president, Ellen Johnson Sirleaf, was voted in power were managed partly by the UN. This time, though, election officials who had been preparing for months took their places at polling stations and attended to complaints from voters. Observers reported long lines at many polling stations, even at closing time. Many analysts do not believe that any of the 20 presidential candidates will win outrightly. There are also roughly 1,000 candidates from 26 parties fighting for 73 legislative seats. More updates on the Liberian elections at midday.